Welcome to this Flamingo Friday. It is Ask Dr. Ben. No questions for today, but we've got a couple updates. The first update is about hydroxychloroquine. So you may have seen this in the news. There was a big study that we talked about that was in the Lancet, if I remember correctly. And it wasn't a clinical study, it was a sort of a roundup of a bunch of other people's clinical data, trying to put together all the little piles of data to make a great big study and get a really clear picture of whether or not this drug had any promise. And it showed that it didn't, but that paper has been retracted now. This happened yesterday. The reason for the retraction, so it started out as a bit of investigative journalism, very nice, and there were some inconsistencies, like on the website, apparently, where you click the link if you were a hospital to send them your data, it didn't go anywhere, or it went to like a Bitcoin mining site or something just insane like that. Yeah. And there was something else, like you couldn't actually call their office, the number redirected or wasn't connected, and it didn't seem like the people that were working there had any particular knowledge of this sort of stuff. So yeah, so that paper ended up having to be retracted. The authors had taken that data in good faith, and after investigation, they concluded that they could no longer rely on it, which is a shame, but this stuff happens. Yeah. So where are we now with hydroxychloroquine? All right, just because this big study has been pulled, it doesn't mean there is new data that suggests that it is actually secretly super effective. So the biggest studies that we have from the United States are two. The one was run by the VA hospitals, so the U.S. military, and the other one is from New York State. It's Galeris et al. It's called Observational Study of Hydroxychloroquine in Hospitalized Patients with COVID-19. And this paper has, there we go, 1,446. I'm scrolling down so I can see the number. Patients in it, and it shows no significant improvement. It doesn't show worsening, which it looked as though there may actually be worsening in that VA study. And so it's possible that, yeah, that it's not quite as bad as that other study would have led us to believe, but it still doesn't look particularly positive. So as a result of this, some of the clinical trials that were stopped after that big Lancet study came out have started again, and they'll continue, and they will collect their data as, yeah, exactly the way you're supposed to do, and then at some point down the road, maybe in a month, maybe 2 months, we should actually see those studies start to be published, and we should be able to tell whether or not this has any effect. Thanks very much. I'll get the phone.